Good morning friends, welcome on my channel Charming Science. Today we are going to talk about a bone, femur. So the femur is the longest and strongest bone in the human body that is essential for supporting body weight and enable a striding gait. It has a two ends, the upper end, lower end, and in between them there is having a shaft. When we see the shaft is nearly cylindrical for most of its length and slightly bowed forward to withstand weight and muscular forces. In the proximal end of the femur, there is having a head, neck, greater trochanter and lesser trochanter. The head is a rounded shaped structure which articulates with the hip or the acetabulum. The neck is a short structure extending medially, connecting the head to the proximal shaft of the femur. There is a two bony landmark. One is the greater trochanter and the another one is the lesser trochanter. They are the bony projections for the muscle cell attachments. In distal end we will see it's having a broad and substantial presenting a double condyle structure which articulate with the condyles of the tibia. The functional alignment, there is having a femoral inclination. The femoral shafts angle upward and outward from the tibial articulation to align with the bone. The femoral head positioning separated by the pelvis width aids in efficient weight distribution. There is having a femoral obliquity. This can be varies between individual, generally more pronounced in women due to broader pelvis and pelvic femoral. There is having an ankle alignment. The tibia and fibula descend vertically from the knee, aligning the ankle directly under the body weight while standing and walking. There is having a biomechanics relevance. The femur length and angulation provide stability and facilitate walking, reflecting an evolutionary adaptations movement. So whenever we get the femur, how we will determine its side? The upper end bears a rounded head, whereas the lower end is widely expanded to form two largest condyles that attach to tibia. The head will be directed medially and the cylindrical shaft is convex while the forward. The anatomical position of the femur is present that the head is directed medially upward and slightly forward. The shaft is directed obliquely downward and medially so that the lower surface of the two condyles of femur lie in the same horizontal planes. There is having a alignment for the femoral head. The position and the orientation, the head forms more than a half a sphere and are directed medially upward and slightly forward. It articulates with the acetabulum to form the hip joint. A roughened pit is situated just below the behind to the center of head. This pit is known as the fovea. Again we will read about the orientation and articulations of the femoral head. The position, the femoral head faces antero-superior-medially. It's having a structure antero-superior-medially to fit in the acetabulum of the pelvis bone or the hip bone. Its shape is described more than a half of a square. The femoral head is spherical rather than a perfect sphere and enabling stable hip articulation. There is having a fovea. A fovea is a small rough depression that lies posterior inferior to the center of the head. Its articular surfaces are mostly smooth with a distinct articular margins, exception anteriorly. The anterior surfaces extend onto the neck of the femur, the acetabulum labrum, encircle the femoral head slightly below its equator and adding stability to the hip joints. There is having a ligament attached to it, that is the ligamentum teres, that attached to the fovea, providing limited stability to a small blood supply of the head. Anterior relationships: the anterior surface of the femoral head is separated from the femoral artery by the tendon of psoas major, iliopectineal bursa, and the articular capsules. When we look onto the surface of the proximal femur or the head of the femur, we will find that this is on the number first. This is the number first structure, that is the fovea of the head. As we talked about that, it's a roughened pit that is situated just below and behind the center of the head, and this is known as the fovea. The second structure is present. Here is the second structure that we will see anteriorly more clear. It is the greater trochanter. So greater trochanter is a large quadrangular prominence located at the upper part of the junction of the neck with the shaft. The upper border of the trochanter lies at the level of the center of the head. There is having the third number, that is the head of the femur. It's in the posterior, and this is in the anterior view of the head of the femur. There is having a fourth number, there's having a very less margin in the posterior structure and having a clearly observable in the anterior structure, that is the intertrochanteric line. So we will find that this is the line that is running from the above near the GT, greater trochanter, to the lower side of the body toward the lesser trochanter. This line is known as the intertrochanteric line. The intertrochanteric line, it is the junction of the anterior surface of the neck with the shaft with joint with the shaft of the femur. There is having a fifth number. There is in the anterior, and this is in the posterior structure. It is the lesser trochanter. Lesser trochanter is a conical eminence that directed medially and backwards from the junction of the posterior inferior part of the neck with the shaft. There is having a sixth point, that is known as the neck of the femur. So generally it connects the head with the shaft, and it's generally around 3.7 centimeter long. There is having another point is the number 8, that's only present in the posterior view. It is the quadrate tubercle on intertrochanteric crest. It's the rounded elevation that is known as the quadrate tubercle on the intertrochanteric crest. There is having a ninth, that is the shaft that is going to start of the femur. 10th, there is not having a 10th number, but it's an 11th. So the 11th is the trochanteric fossa. The 11th is the structure called trochanteric fossa. When we go on the another slide, we will find that there is having some muscles attachment that is going to attach on the proximal part of the femur. So first of all, we will find that the number 1, this is the number 1 structure. This is the placement or the landmark where the gluteus medius is going to attach. The gluteus medius is insert onto the ridge on the lateral surface behind the ridge of the gluteus maximus. There is the another number, that is the number 2. This is the structure this is the place where the gluteus minimus is inserted there into the rough lateral part of the anterior surface. There is another structure is bifemoral. There is a structure called bifemoral ligaments that is going to attach on it. There is another structure, the ligament of head of femur, that is the fourth structure where the ligamentum fovea is going to attach on it, or the ligamentum femoris is going to attach on the fovea of the head of the femur, that is going to provide. There is the fifth number where the obturator, there is a muscle obturator externus. Obturator externus muscle is going to attach on it, and it's going to insert onto the trochanteric fossa. There is having a sixth number, that is for the obturator internus and the gemelli muscles. It is going to, these muscles are going to insert into the upper rough impression on the medial surfaces. There is another structure, that is seventh number, is for the piriformis muscles. The seventh structure is for the piriformis muscle, and the piriformis muscle is going to insert on the apex of the greater trochanter. There is another muscle, that is the psoas major and iliacus, that is on the number 8. And this is the view where the muscle psoas major muscle is going to insert on the apex of the medial part of the rough anterior surface, and the iliacus muscle is insert on the anterior surface at the base of the trochanter on the area below it. The another muscle is the quadratus femoris, that is the number 9th. That is the muscle number 9 that is going to attach the quadratus femoris, that attach near the quadrate tubercle, or the insert at near the quadrate tubercle. There is having a 10 number is for the vastus intermedius. The 11 is for the vastus lateralis, and 12 is for the vastus medialis. So when we talk about these vastus lateralis, vastus medialis, and vastus intermedius, the vastus lateralis, that is the number 11, is arise from its upper part of the intertrochanteric line, anterior and inferior, and aspects the greater trochanter, the lateral margin of the gluteal tuberosity, and the upper half of the lateral lip. The vastus medialis attach or the arise from the lower part of the intertrochanteric line and the spiral line. The vastus intermedius arise from the upper 3/4 of the anterior and the lateral surfaces of the femur. When we see the another structure of the proximal end of the, no, it's not a proximal end, it's a proximal end of the femur, we will find that is the first structure, that is from the behind, that is the structure A. The structure B, that is from the lateral side, and the structure C, that is from, or the while looking above of the structure. So the landmark, bony landmark that is going to attach is, that is the number first. It is the number first attachment, that is the adductor tubercle at the lower end. It is the structure, that is the adductor tubercle at the lower end. The second is the gluteal tuberosity. The second structure is going to attach on there, it is the gluteal tuberosity. The third one is the greater trochanter. The third one is the greater trochanter. The fourth one is the head. Fourth one is the head. Fifth one is the intertrochanteric crest. Fifth is the intertrochanteric crest. The sixth one is the intertrochanteric line. The sixth one is the intertrochanteric line here. The seventh is the lower condyle at the lower end. Eighth one is the lesser trochanter. Ninth one is the linea aspera or the linea aspera. 10th is the medial condyle of the lower end. 11 will be the neck. 12 will be the quadrate tubercle. 13 will be the spiral line. And the 14 will be the trochanteric fossa. When we are going to see the attachment, muscle attachment on it, we will find that the adductor brevis is going to attach on the number 1. The adductor magnus is going to attach on number 2. The gluteus maximum is going to attach at number 3. Gluteus medius attach at number 4. Gluteus 5. The gluteus minimus is going to attach at number 5. Iliofemoral ligament is going to attach as the part number 6. At the 7, the obturator externus is going to join. Obturator externus. Obturator internus is going to attach on the point 8. Point 9, there is having a muscle pectineus. Here is the muscle that is going to attach to the pectineus. 10th one is the piriformis muscles. 11th is the psoas major and the iliacus. 12th is the quadratus femoris. 13th is the vastus intermedius. 13th is the vastus intermedius. 14 is the vastus lateralis. 15 is the vastus medialis that is going to attach on it. When we talk about its structure and orientation, its length is approximately 5 cm long and narrowest at the midpoint and widest laterally. There is having an angle of inclination that is 127° angle, which facilitate hip movement by allowing the limb to swing away from the pelvis. There is having a developmental variation. This angle is widest at birth and gradually decrease until about age 10 and is generally smaller in female. There is having a rotation and counters in it. There is having an anteroversion angle. The neck is rotated 10 to 15 degree laterally with respect to the shaft. Shape. There is having a upper surface, lower surface and the lateral expansion. The upper surface is nearly horizontal and slightly concave. The lower surface is straighter, obliquely directed inferior-laterally toward the shaft near the lesser trochanter, and the lateral expansion is broadened toward the heads of the articular surfaces. The anterior and the posterior features. The anterior surface flat and intracapsular with a rough intertrochanteric line and thus having a shaft junction. Numerous vascular foramina primarily anteriorly and posterior superiorly present. Related to the iliofemoral ligament near the head with the cartilage extending from the head to cover part of its surface. Posterior superior surface convex transversely concave along the long axis, marked by a rounded intertrochanteric crest at its junction with the shaft. There is having a groove for the obturator externus muscle that is known as the obturator externus groove, that is spiral proximal laterally as the tendon approaches the trochanteric fossa. Capsular attachment. Anterior capsule that is attached laterally to the intertrochanteric line, covering much to the neck. Posterior capsule does not reach the intertrochanteric crest, cover only about the medial half of the neck. Functional aspects: the neck provides a lever arm for the hip muscles attached to the proximal femur, aiding in movement. Articular cartilage extension: the facet and the imprints of the neck surface often linked to the cartilage and may relate to the habitual posture like squatting. There is having a greater trochanter. The greater trochanter is a large quadrangular bony projection located at the junction of the neck and shaft of the femur. There is having a position and orientation. The location projects superior medially from the neck, overhanging the adjacent posterior superior surface of the neck. The proximal border position approximately one hand's breadth below the iliac tuberculum, aligning with the center of the femoral head. There is having a surface feature: medial surface contain the trochanteric fossa, a rough area critical for muscles attachments. Anterior surfaces features of a rough impression that serve as an attachment point for the muscles. Lateral surfaces, there is having a continuous with the femoral shaft distally features an oblique flat strap that is wider above and cross anterior-inferiorly. This surface can be palpated particularly when the surrounding muscles are relaxed. There is having a structured trochanteric fossa that present as a tubercle or exostosis variation that can affect muscle attachment and function. There is a functional significance of the greater trochanter. It serves as a critical site for muscle attachment and contribute to the hip joint stability and the functions of muscles such as the gluteus medius and the minimus. There is a structure called lesser trochanter. The lesser trochanter is a conical bony projection located on the posterior medial aspect of the femur, specifically at the junction of the neck and shaft. Its position and orientation: it is situated posterior inferiorly relative to the greater trochanter femoring part of the intertrochanteric region. It's having an anterior surface and the posterior surface. The anterior surface is rough texture providing attachment to points for muscles, and posterior surface is smooth at the distal end of the intertrochanteric crest and aiding in articulation with the surrounding structures. The lesser trochanter is not palpable, meaning it cannot be felt through the skin, which can limit direct clinical examination. There is having a significance role that play an important attachment points for muscles, particularly the iliopsoas, which play a key role in hip flexion. The intertrochanteric line is a prominent anatomical feature that appears as a ridge along the anterior surface of the femur, making the junction between the neck and shaft. Its anatomical location is orientated as the descent medially from a tubercle located on the upper part of the anterior aspect of the greater trochanter, and termination reaches a point on the lower border of the neck situated anterior to the lesser trochanter, which an additional tubercle may also be found. Functional significance: hip joint capsule serve as the lateral limit of the hip joint capsule on the anterior side. The ligament attachment: the upper and the lower bands of the iliofemoral ligament attached to the proximal and the distal end of the intertrochanteric line, as well as associated tubercle. These ligaments play a crucial role in stabilizing hip joints. Continuity: in distally, the intertrochanteric line transitions into the spiral line, which contribute to the overall structure integrity of the femur. The intertrochanteric crest is a prominent ridge that located on the posterior surface of the femur, marking the junction between the neck and the shaft. Anatomical location: orientation: the crest and the descent medially from the posterior superior angle of the greater trochanter of the lesser trochanter. Quadrate tubercle: a low round quadrate tubercle is found a little above the center of the intertrochanteric crest, serving as an important attachment point. Muscle relationship: the intertrochanteric crest is covered by a gluteus maximus muscles. It is separated from the gluteal maximus medial to the tubercle by the quadratus femoris muscles and the upper border of the adductor magnus muscles. There is having a functional significance, that is the intertrochanteric crest serve as an important anatomical landmark for muscle attachment, contributing to the stability and the movement of the hip joint. There is having a structure gluteal tuberosity. The gluteal tuberosity can manifest as either an elongated depression or a prominent ridge on the posterior aspects of the femur. Variability, prominence in some individual, the gluteal tuberosity may be sufficiently prominent to the referred to as a third trochanter, highlighting the potential significance in anatomical term. The functional significance, the gluteal tuberosity serve as an important site for the muscle attachment, particularly for the gluteus maximus, and it's playing a key role in hip extension and stabilization. When we see the shaft of the shaft of the femur is surrounded by a muscles rendering it impalpable. The anatomical feature there is having a suprapatellar bursal located on the distal anterior surface, extended 5 to 6 cm above from the patellar articular surface, position between bone and muscle. The distal lateral surface is covered by a vaster intermedius muscle. The medial surface is covered by the vaster medialis, and it's having a shape that is narrow centrally and expands slightly at the proximal end and more substantially at the distal end. The long axis makes an angle of approximately 10 degrees with the vertical diverging 5 to 7 degrees from the long axis of the tibia. The surface and borders. There is having a middle third contain three surfaces and border. Anterior surface that is extensive, smooth and gently convex. Lateral and medial surface that is both rounded and indistinct. Posterior lateral surface bounded posteriorly by the linea aspera, which is broad and rough with lateral and medial edges. Line of force and muscle attachment. The linea aspera is strengthened to the shaft withstand compressive forces concentrated here due to the anterior curvatures. There is the attachments include on that the adductor longus, intramuscular septa, short head of biceps femoris, perforating arteries, and the nutrient foramina. The structure of the femoral shaft is primarily a cylindrical of compact bone containing a large medullary cavity. The thickest wall is found in the middle third of the shaft, where it also narrowed and the medullary cavity is most capacious. The proximal and distal end, the compact wall become more progressively thinner towards the ends, where the cavity fills with the tubercular bone. The tubercular bone structure at the extremities, especially at the articular surfaces. Tubercular bone exists within a small cell of compact bone. The tubercular align along with the greatest stress. At the proximal end, the main tubercle of structure from the plates of the orthogonal to the articular surfaces converging into a central dense wedge. A strong tubercular element extend to the neck asides, particularly along its upper and the lower surface. The force transmission, the force applied to the femoral heads are transmitted through the wedge of the junction of the neck and shaft. The junction is fortified by the dense tubercle that extend laterally from the lesser trochanter, counteracting tensile or shearing forces. Tubercular strength, the test indicates the axial tubercle of the femoral head that can withstand significantly greater stress compared to the peripheral tubercle. A smaller bar at the junction of the greatest trochanter with the neck and the shaft helps resist shearing forces from the attached muscles. Calcar femoral, a thin vertical plate is known as the calcar femoral, ascends from the compact wall near the linea aspera into the tubercular bone. It joins the posterior wall of the neck medially and displaces into the tubercle bone laterally to the greater trochanter. Thus, having a trabecular framework, the trabecular framework to the proximal femur has a spiral configuration with arches representing simplified profile of the spiral. At the distal end, tubercles extend from the internal surface of the compact bone running perpendicular to the articular surface. Proximal to the condyle, these tubercles are strongest and the most accurately perpendicular, forming horizontal planes like cross girdles, creating a series of the cubical compartment. The posterior medial surface of the shaft is smooth, bounded in front of the indistinct medial border behind by the linea aspera. The proximal third The medial boundary is narrow, rough spiral line, continuous proximally with the intertrochanteric line and distally with the medial edge of the linea spira. Lateral boundary broad, rough gluteal tuberosity extending toward the greater trochanter. Distal 1/3 present with the popliteal surface triangular in outline located between the medial and the lateral supracondylar line, which are continuous above with the edge of the linea spira. The lateral line is going to give attachment to the short head of the biceps femoris and the lateral intermuscular sputum. The medial line is indistinct from the proximal two-third, whereas the vastus medialis it attaches and becomes sharper distal to the adductor tubercle. Popliteal surfaces features rough and slightly elevated in its distal medial part, forming part of the floor of the popliteal fossa, often covered by the fat separating the popliteal artery from the bone. Arterial relationship: the superior medial genicular artery arches medially above the medial condyle, separate from bone by the medial head by the of gastrocnemius. The superior lateral genicular artery arches laterally proximally to the lateral condyle, separated by the attachment of plantaris to the lateral supracondylar line. There is having a structure of the shaft of the femur. So there is a structure. There is the first structure that is from the posterior. The second structure is from the it's also from the posterior. So the number one structure, the number one is the bony landmark, that is the gluteal tuberosity. The second one is the lateral supracondylar, and the third one is the lesser trochanter. The fourth one is the linea spira. The fifth one is the medial supracondylar line. Sixth one is the pectineal line, and the first one is the gluteal tuberosity. There is having a bone. In the another structure, this is the muscle attachment. So at the first structure, as the first line, here is the first line where the adductor brevis is going to attach. There is the second, that is where the adductor longus is going to attach. At the third, adductor magnus will attach. Fourth, gluteus maximus will attach. At fifth, pectineus will attach. At sixth, psoas major. Where is the structure 6? Here is 6. At 6 is the psoas major and iliacus is going to attach. At the 7th, quadratus femoris is going to attach. At 8th, short head of biceps femoris. At 9, vastus intermedius. 10th, vastus lateralis, and at the 11th, vastus medialis is going to attach. When we talk about the distal end of the femur, the distal end of the femur is significantly expanded, providing by a robust bearing surfaces for the transmission of weight to the tibia. Condyles: the distal end and the features of two massive condyles, medial and lateral, which are partially articular. There is having an anterior surface. The condyles are confluently connected at the continuate shaft. Posteriorly, they are separated by a deep intercondylar fossa that project beyond the planes of the popliteal surfaces. There is an articular surfaces. The articular surfaces resembles as an inverted U designed for articular with the patella and the tibia. Patellar surfaces extend anteriorly on both condyles with the greater expansion on the lateral condyle. Characteristic: that is transversely concave, vertically convex, and grooved for the posterior patellar surface. Tibial surfaces divided by the intercondylar fossa, maintaining continuity with the patellar surface anteriorly. Medial part: broad strip on the convex inferior posterior surfaces of the medial condyle, gently curved with the medial convexity. Lateral part covers similar aspects of the lateral condyle, broader and extends straight back. There is having a curvature and the motion. The tibial surface exhibits convexity in all directions with differing anterior-posterior curvatures. There are varying opinions regarding to the representation of these curvature. There is a traditional view suggests that in both the tibial portion the sagittal radius of curvature decreases. The tradition proposed that the Medial articular surfaces comprises arcs of the two circles with the more posterior circles having a smaller radius. The lateral condyles may present a single arc of fixed curvature similar to the posterior arc of the medial femoral articular surfaces. The clinical significance: these differences in curvatures and surface designs are believed to play a critical role in determining knee joint motion and stability during activities such as walking, running, and jumping. When we talk about the patellar surface of the femur, the patellar surface of the femur is designed for the articulation with the patella extending from proximally to the lateral side. There is having a borders and grooves. The proximal part of the patellar surface is oblique and running distally and medially. It is separated from the tibial surfaces by two fan grooves that cross the condyles obliquely. Beyond the medial groove, there the patellar surface continues to the lateral part of the medial condyle as a semilunar area. In variation in habitual squatters, in individuals who habitually squat, the articular cartilages may extend. Intercondylar fossa of the femur. The intracondylar fossa is a deep notch that separates the two condyles of the femur distally and posteriorly. There is having a boundaries and anterior and posterior. The anterior limited by the distal border of the patellar surface and the posterior is limited by the intercondylar line which separate it from the popliteal surfaces. The fossa is intracapsular but large extrasynovial, meaning it is within the joint capsule but not lined by the synovial membrane. Walls and the ligaments attachment. Lateral wall formed by the medial surface of the lateral condyle featured by the flat posterior superior impression that extend toward the floor of the fossa near the intercondylar line that serve as the proximal attachment for the anterior cruciate ligament. There is having a medial wall that is composed of the lateral surface of the medial condyle. This contains the large area position more anteriorly serving as the proximal attachment for the posterior cruciate ligaments. Surface characteristic: the impression for the both the ACL and the PCLs are smooth and largely free of vascular foramina. The remaining area of the intercondylar fossa is rough and marked by vascular foramina. Associated structure, that is a bursa recess, may be present between the ligaments and the extending into the fossa. The capsular ligaments and laterally the oblique popliteal ligament are attached to the intercondylar line. The infrapatellar synovial fold is attached to the anterior border of the fossa. It's a structure in which there is having a number one, that is the adductor tubercle. The second one is the groove for the popliteal tendon. The third one is the impression for the lateral head. The fourth one is the intercondylar fossa. Fifth one is the lateral condyle. Sixth one is the lateral epicondyle. Seventh is the medial condyle. Seventh is the lateral supracondylar line. Eighth is the medial condyle. 9 is the medial epicondyle. 10th is the medial superocondylar line. And 11th is the patellar surface. The 12th is the popliteal surfaces. When we talk about its muscle attachment, then we will see that at the number first, that is the adductor magnus is going to attach. At the second, it's the attachment for the anterior cruciate ligament. Third, articularis genis is going to attach on it. At the fourth, fibular collateral ligament. At the fifth, lateral head of the gastrocnemius. At sixth, medial head of the gastrocnemius. At seventh, plantaris muscles is going to attach. At eighth, popliteus muscles is going to attach. At 9, posterior cruciate ligament is going to attach. At 10th, short head of biceps femoris. at 11 tibial collateral ligament, at 12 vastus intermedius, and at 13 vastus medialis is going to attach. The lateral condyle of the femur. The lateral condyle is the larger on the anterior-posterior dimension compared to the medial condyle. It's having a prominent feature that is to the lateral condyle is the lateral epicondyle to which the fibular collateral ligaments is attached. A short groove is present inferiorly deeper in the front which separates the lateral epicondyle from the articular margins. The groove allows the tendons of popliteus to run deep into the fibular collateral ligaments and insert inferior and anterior to the ligaments insertion points. There is having a joint margin that is a 1 centimeter broad strip of condyles. This area is intracapsular and covered by a synovial membrane. The medial surface of the lateral condyle forms the lateral wall of the intercondylar fossa, and the lateral surface projects beyond the femoral shaft. The lateral head of the gastrocnemius attached to an impression that is located posterior superior to the lateral epicondyle. The medial condyle of the femur is having a bulging convex medial aspect that is easily palpable. There is having a adductor tubercle located proximally on the medial condyle, and it may appear convex medially aspect that is easily palpable. There is having a adductor tubercle that located proximally on the medial condyle, and it may appear as a facet rather than a distinct projection. This tubercle receives the tendon adductor magnus. There is having a structure medial epicondyle. The medial prominence of the condyle known as the medial epicondyle and is located anterior inferiorly to the adductor tubercle. The lateral surface of the medial condyle to form medial wall of the intercondylar fossa. The projection and profile, the condyle project distally, ensuring that despite the obliquity of the femoral shaft, the profile of the distant end remains almost horizontal. Articular surface, a curved strip 1 cm wide adjacent to the medial articular margins is covered by synovial membrane and lies within the joint capsule. The medial epicondyle provides attachment for the tibial collateral ligaments. This is having a structure in which we are going to see the bony landmarks, in which at the first point is for the adductor tubercle. It is a bony landmark. The second one is the groove for the popliteus tendon. The third one is for the impression for the lateral head of the gastrocnemius. There is not having a fourth one. There is a fifth one, that is the lateral condyle. Sixth one is the lateral epicondyle. Eighth is the medial condyle. 9 is the medial epicondyle. 10th is the medial supracondylar line. There is having a muscle attachment is going to attach on it. That is, first is the adductor magnus. The first structure is the adductor magnus is going to attach. The fourth one is the fibular collateral attachment for the fibular collateral ligament. Fifth one is the lateral head of the gastrocnemius. Sixth one is the medial head of the gastrocnemius. There is not having a 7. This is the 8. That is the attachment for the popliteus muscles. And this is the 11. That is the tibial or the medial collateral ligament is going to attach here. The muscle attachment on the femur. At the greater trochanter, the gluteus minimus, gluteus medius, gluteus maximus, piriformis, obturator internus, gemelli, and obturator externus is going to attach. At the lesser trochanter, there is having a muscle psoas major and iliacus going to attach. At adductor magnus, there is having a upper part and the lower part is going to attach. Quadriceps group, it's having a 4 muscles, that is the vastus lateralis, vastus medius, vastus intermedius, and the articularis genius is going to present. That is known as the biceps femoris. Gluteal tuberosity, that provides attachment to the gluteus maximus and the adductor magnus. There is having a pectineus muscles and the adductor brevis. Adductor longus is going to attach on it, and at the distal attachment, distal end of the femur is going to attach the medial head of the gastrocnemius, short head of the biceps femoris, plantaris muscles, vastus medialis muscles, lateral head of gastrocnemius, and the popliteus muscles is going to attach. Vascular supply, the femur get their vascular supply by the medial and the lateral circumflex arteries, and some contribution from the superior and inferior gluteal vessels. There is having a ascending cervical branches. There is having a some fracture that is going to occur on it, that is the intercapsular fracture and the extracapsular fracture. There is having a trochanteric and the soft supply, venous drainage, and the innervation of the femur. The innervation of the femur, when we talk about the ossifications of the femur ossifies from five primary centers, that is one for the shaft, head, greater trochanter, lesser trochanter, and the distal ends, that is the condyles and epicondyles. The timeline of ossification, the femur is the first long bone to ossify, beginning its development in the 7th prenatal week, and mid-shaft ossification starts producing a largely ossified shaft by birth. Secondary ossification centers as the distal end, it has a ninth month of gestation period. Head appear during the first 6 months after birth. GT is going to ossify in the 4th year. Lesser trochanter is going to ossify in the 12th and 14th year. Characteristics of femoral head. In infant, the femoral head is entirely cartilaginous and not visible on plain radiograph. It is best viewed through ultrasound. The center of ossifications remain in the cartilaginous head until around the 10th year. Epiphyseal development, the epiphyseal line remain horizontal with the inferomedially part of the articular surface on the neck. The medial epiphyseal margin later grow over the area, resulting in mature epiphysis resembling a hollow cup top at the neck. The epiphyses fuse independently. Lesser trochanter fuses soon after puberty. Greater trochanter fuses after the lesser. Capital epiphysis fuses at the 14th in female and 17th in male, and the distal end epiphysis fuses at the 16th in female and 18th in male. Epiphyseal plate, the distal epiphysis plate run across the adductor tubercle. That's all for the bone of the femur. If you like this lecture, please like, subscribe, and share our channel Charming Science. Thank you very much.